Hello friends, very good evening. Let's today us talk about the heart problems. In the winter days especially, there is contractions of muscles as there is shivering and heart patients suffers lot of problems. There are a lot of how the doctor detect that there is problem with the heart with the stethoscope when this percussion sounds we listen through this because the resonance make the sound very clear like microstenosis or aortic regurgitations, normal sound fibrillations we detect through this stethoscope. What happened in the winter days? The heart patients, when in high blood pressure, the coronary artery supply of the oxygen get diminished sometimes, and there may be clotting in the winter time as the cold climate make the arteries contraction, sympathomimetics effect. Because of that contraction, and if also having the high blood pressure or heart problem or respiratory pulmonary problems, there may be the strictures of the narrowing of the coronary arteries, and there are chances of blockage in winter days. So continue what the precautions we should take to avoid heart problems in winters is that continue to take little warm water, tea, coffee, soups, and